Hello, welcome to the Evexia Diagnostics video series on ready-to-run Evexia panels. This is part 3 and will cover an overview of cardio panels. Now, the presenter for today's topic, the Director of Clinical Support and Education, Dr. Wayne Sedano.
Hi, this is Dr. Sedano, and welcome to the Evexia Diagnostics Cardiovascular Panels Overview. This presentation reviews the analytes included in each panel and their clinical usefulness. So let's get started. So here's the cardiovascular panels offered by Evexia Diagnostics. There's the basic cardiovascular panel, complete, comprehensive, and the premier cardiovascular panel. Now, these panels offer an array of biomarkers from the baseline biomarkers to the most advanced biomarkers of cardiovascular health assessment. They include the basic test and panels, also called the core test and panels, such as the CBC and comprehensive metabolic panel. Now, cardiovascular disease continues to be a leading cause of death in the United States, and 1 out of every 3 deaths in the United States is related to cardiovascular disease. Important indicators of cardiovascular risk assessment include the individual's family and personal history, physical exam findings, and laboratory test markers. Individuals who can greatly benefit from cardiovascular laboratory testing include those with diabetes, high blood pressure, poor diet, smokers, overweight and obesity, family history, a lack of exercise, and advanced age, as well as from a preventive medicine perspective. Another great feature of the cardiovascular panels and all the Evexia diagnostic panels is that they come with a functional health report. Now, this type of report looks for early changes in blood chemistry that can indicate the risk or potential presence of many health conditions. Some of the benefits and features of the report include optimal and standard reference ranges, a historical comparison of the previous blood test results, and details about each analyte and nutraceutical recommendations. So the Evexia Basic Core Panel contains the core tests that are components of all of the cardiovascular panels, and you see them outlined on the slide. There's apolipoprotein B, the CBC with differential comprehensive metabolic panel, high sensitivity C-reactive protein, creatine kinase, fibrinogen activity, hemoglobin A1C with the average hemoglobin, homocysteine, insulin, lipoprotein A, magnesium, and the NMR Lipoprofile with insulin resistance markers. And I'll be going over each one of these. So first is the apolipoprotein B. Now that's a protein that is involved in metabolism of lipids and is the main protein constituent of lipoproteins such as the very low density lipoproteins and the low density lipoproteins. Now it's important to understand that the cholesterol that the LDL and apolipoprotein B transport, it's vital for the cell membrane integrity and for hormonal production. However, in excess, it can lead to fatty deposition in the arterial walls, which is going to increase the risk of heart attack and cardiovascular disease. Essentially, an elevated level of ApoB corresponds to elevated levels of low-density lipoprotein C and to non-high density lipoprotein C, which are risk factors for cardiovascular disease. Now, an increase in apolipoprotein B is also associated with diabetes with certain medications, hypothyroidism, and kidney disease. Next is the complete blood count with differential. Now, that's going to provide substantial information that assists in the diagnosis and treatment of many conditions such as anemia, infections, cancer of the blood cells, inflammation, environmental toxin exposure, renal disease, liver disease, autoimmune disease, and nutrient deficiencies. Next is a comprehensive metabolic panel, or the CMP. So that's a group of tests that measures several different substances in the blood, and it's going to provide information about electrolyte balance, liver and kidney function, glucose regulation, and the level of proteins. The next analyte on the basic cardiovascular panel is the C-reactive protein, high sensitivity. Now, it's important to know that CRP is a protein that is produced in the liver, and CRP levels in the blood indicate that there is a condition causing inflammation somewhere in the body. So essentially, CRP is a marker of inflammation, and studies have shown that measuring CRP with high sensitivity tests can help identify the risk of cardiovascular disease. Next is creatine kinase. Now that's an enzyme that catalyzes the reversible phosphorylation of creatine by ATP, adenosine triphosphate. So here's what happens. When the muscle contracts, right, it uses ATP, then the ATP is converted to ADP. And the creatine kinase catalyzes the rephosphorylation of ADP to ATP. Now, creatine kinase activity is greatest in the striated muscles, heart muscle, and brain. And serum increases in this enzyme is associated with injury or inflammation to the heart, skeletal muscle, and brain tissue, which is why it's included in the basic cardiovascular panel. Next is the fibrinogen activity test. Now, this test evaluates part of the clotting process in which the soluble fibrinogen is converted into fibrin threads. Now, this test measures the time it takes for the fibrin clot to form after a standard amount of thrombin is added to the blood sample. The time it takes for the clot to form directly correlates with the amount of activity or active fibrinogen that is present. Now, fibrinogen is also an acute phase reactant, meaning that the level of this analyte will increase in cases of acute tissue inflammation and/or tissue damage. An increase in fibrinogen is associated with infections, with cancer, coronary artery disease, heart attack, stroke, inflammatory disorders, trauma, peripheral vascular disease, and heavy smoking. Next is the analyte homocysteine. Now, homocysteine is an amino acid that is typically present in small amounts in all the cells of the body. The body normally converts homocysteine into other products quickly, and certain nutrients are required, such as vitamin B6, B12, and folate. And homocysteine is part of the methylation pathway. Now, elevated homocysteine is a risk factor for coronary artery disease, stroke, peripheral vascular disease, and hardening of the arteries. There is also a rare genetic condition called homocystinuria that can also greatly increase homocysteine in the blood and urine, and I want you to be aware of that. Next is fasting insulin. Now, measuring fasting insulin when compared to fasting glucose, that can provide information about the possibility or the presence of insulin resistance, prediabetes, diabetes, as well as the level produced by the pancreas. So as you know, insulin is a hormone that is produced and stored in the beta cells of the pancreas. It's secreted in response to elevated blood glucose following a meal and is vital for the transport and storage of glucose into the cells. And as you know, glucose is the body's main energy source. Now, insulin helps transport that glucose, like I said, into the cells. If an individual is not able to produce enough insulin, or if the body cells are resistant to the insulin effect, otherwise known as insulin resistance, glucose cannot reach most of the body cells and the cell starves. Meanwhile, glucose will rise in the blood, causing an unhealthy level. And a continual increase in blood glucose has been associated with kidney disease, cardiovascular disease, vision, and neurological problems. Next is lipoprotein A. Now, the lipoprotein A consists of an LDL molecule that has a protein attached to it called apolipoprotein A. Now, lipoprotein A is similar to LDL cholesterol, but it does not respond typically to strategies that will help lower the LDL cholesterol, such as diet, exercise, and most lipid-lowering treatments. The level of apolipoprotein A appears to be genetically determined and is not easily altered, and the presence of a high level of this analyte is used to identify individuals who might benefit from more aggressive type therapies to help reduce the risk. Next is magnesium, and magnesium is involved in virtually every metabolic process occurring in the body. It's a component of the bone, it's needed for nerve transmission, it's an enzyme cofactor and needed for protein synthesis. So knowing the status of this nutrient is especially important. Now, magnesium is a key cardiovascular regulator which maintains electrical, metabolic, and vascular homeostasis. The final test on the Evexia Diagnostics basic cardiovascular panel is called the NMR Lipoprofile test. Now, this test is FDA cleared for use in conjunction with other lipid measurements and clinical evaluation to aid in the management of lipoprotein disorders associated with cardiovascular disease. The components of this test are listed on the slide. As you see, there is a historical report of the LDL-C and LDL-P, which I'll be going over, insulin resistance and diabetic risk markers, the insulin resistance score, lipoprotein particle concentration and size, and the standard lipid panel components we're all used to seeing: total cholesterol, triglycerides, LDL, and HDL. So let's take a closer look at the NMR lipoprofile report. So the LDL-P is the direct measure of the low-density lipoprotein particles, and a causal link between high levels of these particles and the risk of cardiovascular disease is well established. Now, just underneath the LDL-P is the LDL-P historical reporting. So you'll get a historical reporting, as you see on the bar graph, That's going to provide you information about tracking the individual's progress over time. With serial testing, you'll get the lab date and the values. On the right part of this slide are the LDL and HDL particles. Now, HDLP, or the high density lipoprotein particles, is a measure of those particles, and these particles have been shown to be more strongly and independently related to atherosclerotic risk than just the HDLC. Just underneath that is the measurement of the small LDL particles. Now, small LDL particles, also called pattern B, as you can see on the slide, are associated with an increased risk of cardiovascular disease. The small LDL particles are more prone to be deposited in the arterial wall, causing damage. Next are the lipoprotein markers associated with insulin resistance and diabetes. Now, together, the markers listed create an insulin resistance score, which can provide information for early detection of type 2 diabetes. Next is the Evexia Diagnostics Complete Cardiovascular Panel. So aside from the analytes I just mentioned that are included in the basic cardiovascular panel, this panel adds an additional 8 biomarkers pertinent to cardiovascular health. And they're going to include the apolipoprotein assessment, direct bilirubin, gamma-glutamyl transferase, lactic acid dehydrogenase, phosphorus, uric acid, the urinalysis with microscopy, and vitamin D25 hydroxy. So let's review these. The apolipoprotein assessment assesses both the alpha and beta apolipoproteins. Now, apolipoprotein B, as I just mentioned, is a protein involved in the metabolism of lipids and is the main protein constituent of the lipids, such as the very low density lipoproteins and low density lipoproteins, like I mentioned. Now, ApoB levels tend to mirror the low density lipoprotein cholesterol levels, and they appear to be a better indicator of cardiovascular risk than the LDL-C. The apolipoprotein A is a protein that has a specific role in the transport and metabolism of lipids and is the main protein component of the high density lipoproteins. Apolipoprotein A activates the enzymes that carry cholesterol from the tissues into the HDL and then sends it back to the liver for metabolism. And a decreased level of apolipoprotein A is an increased risk factor for developing cardiovascular disease. Now, the assessment also includes the ratio of apolipoprotein A to apolipoprotein B, which is a risk factor indicator for cardiovascular disease and coronary artery disease. Next is direct bilirubin. And as I mentioned earlier, the comprehensive metabolic panel contains the analyte bilirubin. Now, bilirubin, as you know, is formed from the hemoglobin that's released after the breakdown of the RBCs. And an increase in total bilirubin typically means hepatobiliary dysfunction. Now, there are two main components to the total bilirubin. There's the direct bilirubin and the indirect bilirubin. And an increase in the direct bilirubin typically indicates gallstones, extrahepatic duct obstruction, or cholestasis. And by the way, the level of the indirect bilirubin can be obtained by subtracting the direct bilirubin value from the total bilirubin value. And an increase in indirect bilirubin is associated with certain types of anemia, especially hemolytic anemia, and also a genetic disorder called Gilbert's syndrome. Next is the analyte gamma-glutamyl transferase. Now, GGT is an enzyme that is found in many organs throughout the body, but has the highest concentration found in the liver. GGT is elevated in most diseases that cause damage to the liver and or the bile ducts. This enzyme, what it does, it participates in the transfer of amino acids and peptides across the cellular membrane and is responsible for extra metabolism of glutathione, which, as you know, is the main antioxidant in the cell. An increase in GGT is associated with liver disease, alcohol abuse, gallbladder disease, fatty liver, diabetes, pancreatitis, environmental toxins, and oxidative stress, to name a few. Next is the enzyme lactic dehydrogenase or lactic acid dehydrogenase, and that enzyme is found in many cells of the body, especially the heart, liver, RBCs, kidneys, skeletal muscle, brain, and the lungs. So an elevation in HDL is associated with various disease states. Next is the element phosphorus. Now, phosphorus is a structural component of the bone, teeth, and it's essential for DNA, RNA, ATP production, and cell membrane health. Phosphorus deficiencies have been seen with malnutrition, malabsorption, acid-base imbalances, and disorders that affect the kidney. And as it relates to cardiovascular disease, phosphorus or phosphate levels are consistently linked with cardiac calcification, cardiovascular disease, as well as chronic kidney disease. So essentially, disorders of phosphorus metabolism are an independent risk factor for cardiovascular disease. So it's important to take a look at this analyte. Next is uric acid. Now, uric acid is produced by the breakdown of purines. If too much uric acid is produced or not enough is removed, it can accumulate in the body and it can cause gout, as you probably know. Now, excess uric acid can also be deposited in tissues such as the kidneys, leading to kidney disease and also kidney stones. Now, increased uric acid is a common finding in patients with hypertension, insulin resistance, diabetes, and cardiovascular disease. You definitely want to take a look at this analyte. Next is the urinalysis with microscopic examination. Now, many disorders can be detected in their early stages by identifying substances that are not normally present in the urine. The urinalysis is also an important tool for assessing various disease states such as urinary tract infection, diabetes, and kidney disease. The last analyte on this panel is vitamin D25 hydroxy. Now, as you know, vitamin D is important for calcium absorption, but it also has received widespread attention for its role in preventing cardiovascular disease, type 2 diabetes, and as an immune system regulator. The low levels of 25 hydroxy vitamin D may mean that a person is not getting enough exposure to sunlight or enough vitamin D to meet the body's needs. Other conditions certainly can lower the level of 25 hydroxy vitamin D. Next is the Evexia Diagnostic Comprehensive Cardiovascular Panel. So aside from containing the analytes I just mentioned that are included in a complete cardiovascular panel, this panel adds 7 additional biomarkers pertinent to cardiovascular health. And they're going to include the analytes you see on the slide: coenzyme Q10, creatine kinase, total NMB, which I'll explain, F2 isoprostane creatinine ratio, lipoprotein associated lipophosphase A2 activity, the fatty acids omega-3 and omega-6, oxidized low-density lipoprotein, and an analyte called troponin 1. So let's review these. Now, coenzyme Q10 is also referred to as ubiquinone because it is found almost in every cell of the body. And as you probably know, coenzyme Q10 plays a role in ATP production, in other words, energy production. And recent findings point to the role of coenzyme Q10 improving cardiovascular health in cardiovascular disease. And by the way, this analyte is decreased with the use of statin drugs, so you need to be aware of that. Next is the creatine kinase with the MB isoenzyme. As I said earlier, creatine kinase is an enzyme that catalyzes that reversible phosphorylation from creatine by adenosine triphosphate. In other words, it converts ADP to ATP. Now, creatine kinase, MB, is the form of the enzyme that is primarily found in heart muscle cells. So when there is an increased amount of creatine kinase in the blood, the creatine kinase MB test can help determine whether it is due to heart damage or is more likely related to skeletal muscle. Next is the F2 isoprostane creatinine ratio. Now, this analyte, the F2 isoprostane, is produced in conditions that result in excess generation of free radicals, including those generated and that can lead to atherosclerosis. Now, essentially, this analyte is going to give you the measurement of oxidative stress, which can damage the endothelial lining of the blood vessels. Next is an analyte called lipoprotein associated phospholipase A2. Now, this enzyme appears to play a role in the inflammation of the blood vessels and is thought to promote atherosclerosis. And recent studies have shown that lipoprotein associated lipophosphase A2 is an independent risk marker for cardiovascular disease, including coronary heart disease and ischemic stroke. Next is the fatty acids omega-3 and omega-6. And as you probably know, the proper balance of these fatty acids is needed for a proper inflammatory and anti-inflammatory response, as well as for the health of the cell membrane. Next is the analyte oxidized LDL. Now, the measurement of oxidized low-density lipoprotein has been incorporated into clinical practice in the diagnosis and treatment of various lipid disorders such as diabetes, atherosclerosis, and various liver and kidney disease. Essentially, the oxidized LDL particles are considered to be an important driver of the pathology of atherosclerosis, which is why they're included in this panel. Next is troponin 1. Now, troponins are a group of proteins found in skeletal and heart muscle fibers that regulate muscular contraction. Troponin test measures the level of cardiac-specific troponin in the blood to help detect heart injury. The final panel is the Evexia Diagnostics Premier Cardiovascular Panel. So aside from containing the analytes I just mentioned that are in the comprehensive cardiovascular panel, this panel adds an additional 6 analytes pertinent to cardiovascular health, and you see them outlined on the slide. There's B-type natriuretic peptide, glutathione, glyce-A, matrix metalloproteinase 9, myeloperoxidase, and an analyte called trimethylamine N oxide. So let's review these. First, B-type natriuretic peptide, that's a 32 amino acid ring peptide, and it's secreted by the heart muscle to regulate blood pressure and also fluid balance. Now, this analyte is stored and secreted predominantly in the membrane granules in the heart vessels, and is continually released from the heart in response to both ventricle volume expansion and pressure overload. An elevation in this analyte can occur due to right heart failure, pulmonary hypertension, acute pulmonary embolism, and acute coronary syndromes. Next is glutathione. Now, as you most likely know, glutathione is a tripeptide and is a primary regulator of cellular redox states. In other words, it's a wonderful antioxidant. The critical roles of glutathione are going to include direct chemical neutralization of singlet oxygens, hydroxyl radicals, and superoxide radicals. In other words, an antioxidant. Glutathione also serves as a cofactor for antioxidant enzymes. It helps regenerate vitamin C and vitamin E. It'll neutralize free radicals produced by phase 1 detoxification and is also involved in phase 2 detoxification. This analyte also helps transport mercury out of the cells and out of the brain. The next analyte is glyce-A. Now, this analyte is a nuclear magnetic resonance composite biomarker of systemic inflammation and reflects serum concentration of glycosylated state in the main acute phase reactants. And an increase in this analyte is associated with cardiovascular disease and a cardiovascular event. Next is the analyte matrix metalloproteinase 9. Now, this is also a marker of inflammation. It's also a marker of tissue remodeling, wound healing, and mobilization of tissue-bound growth factors and cytokines. The way to look at this analyte is when it's increased is that it contributes to the pathogenesis of many clinical conditions such as rheumatoid arthritis, coronary artery disease, COPD, multiple sclerosis, asthma, and cancer. So this can be certainly a red flag for inflammation and damage to those tissues. Next is the analyte myeloperoxidase. Now, this analyte is a heme protein present in leukocytes and catalyzes the hydrogen peroxide mediated peroxidation to produce strong reactive oxidant species that have potential antimicrobial activities against a broad range of invasive parasites and pathogens. But this analyte can also damage tissue. And an increased level of myeloperoxidase has been demonstrated to predict the presence of angiographic coronary artery disease and is a sensitive indicator of inflammatory diseases. The final analyte is trimethylamine N oxide, or TMAO. Now, that is a gut-derived metabolite that has been associated with atherosclerotic burden and increased risk of heart disease. Here's what you need to know about TMAO. It is a dietary metabolite produced by a pathway involving the gut microbiota. Essentially, gut dysbiosis is going to increase this analyte. Now, this analyte has been hypothesized to promote atherosclerosis by upregulating macrophage scavenger receptor activity and downregulating bile acid synthesis, which together reduce reverse cholesterol transport. In other words, it's going to reduce the HDL cholesterol from taking the cholesterol back to the liver.
Thank you for that valuable insight, Dr. Sedano. We will now briefly review where to locate the ready-to-run Evexia Diagnostics panels. When you log into your Evexia account, you are automatically taken to the dashboard. From here, click on the Test Menu tab at the top of the page. You will then be directed to the Evexia Diagnostics test directory. Although you can enter Evexia into the keyword search box, you can simply click the quick link labeled Evexia Panels under the Featured Panels and Tests column on the right, which will bring you to the different categories of ready-to-run Evexia panels. At the top of each category page, this helpful resource provides a general, overall description of why the testing is important, followed by the list of available panels in the category. Scrolling further down the page is a comparison chart. Each panel from the category is listed at the top and can be clicked to be taken directly to a detailed information page specific to that panel. Moving from left to right, you will notice the panels become more comprehensive and encompass greater clinical insight. Test biomarkers are listed in the left-hand column, allowing you to see a breakdown of the analytes included in each panel. These are also clickable links that will take you to informational pages for each biomarker. These pages provide easy access to more specific details like the turnaround time, CPT codes, specimen type, stability, and an overview of the test. If applicable, individual analytes are also listed under the Components tab below the test name, and any particular instructions are listed under the Collection Details tab. Now let's briefly review how to order these panels. First, log into your Evexia account and click on the Evexia link option under the column labeled Quick Links on the left-hand side of the dashboard. Next, find your desired patient or create a new patient. Then, click the button labeled Add New Order to open the test menu and select the appropriate panel or test. Add it to the cart by simply clicking the plus sign on the left-hand side. Finally, preview and confirm your order once it has been added to your cart and complete the process by clicking the Place Order button. You can reach us during our extended business hours between 8 a.m. and 8 p.m. Eastern Time, Monday through Friday, by calling 888-852-2723, or contact us anytime via email at info@evexiadiagnostics.com. We are always happy to assist you with any needs or questions that you may have. Thank you again for joining us for this presentation. Until next time, from everyone at Evexia Diagnostics, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.